Oh no, my dog seems to be in pain. I'll give him some aspirin and it will feel better in no time. Little did you know that this some aspirin caused a poisoning in your dog and you needed to rush off to your vet to actually save his life. In this video, I will walk you through the 8 most common human medications that are actually poisonous for your dog. Now, some of these might surprise you, so please keep watching all the way through and share this video with every dog owner you know. This might actually save a dog's life. And this is information that actually every dog owner should know about. Now, I will mention the symptoms as well. Keep in mind that not all symptoms always occur. Hi, I'm veterinarian Nele de Schrijver and I help cat and dog owners avoid sudden sickness and high medical bills without the long waiting times and stress, and so Dr. Google doesn't give you a heart attack. If you'd like to avoid medical or behavioral problems for your furry friend, be sure to click the subscription button below and hit that bell button so you get notified every time I release a new video. There are so many kinds of human medications that are very bad for your dog, and some of them are actually downright poisonous for your dog. I will walk you through the most common ones and the most dangerous ones using a chart with traffic lights. Red means this is very dangerous for your dog and need to go to the vet right now. Orange stands for meds that are ingested by dogs pretty often. That's are pretty rare, but they have happened before, so always be sure to have your dog checked out by your vet. Green, as you can guess, is pretty safe, but it happens a lot. If there are any symptoms, they will go away by themselves, but that doesn't mean that it's still very unhealthy for your dog to eat. Also bear in mind that vets can't just go about prescribing a human drug to an animal either. We have to follow a certain guideline. It is written by in law, at least in Belgium it is.
We have to give the medication that is specially made for a certain animal, certain species, let's say for dogs. If it is made for this specific problem, we have to give this medication. If that's not working, we can give something else. Or if this is not made for dogs, we could give it from another species for this problem. Like for cats, and we can give for dogs, we call this off-label use. And if there is not for any other animal made for the specific problem, then and only then can we give or prescribe something that is made for humans.
So you see, it is very important that you get veterinary medicine for your animal if he's sick, and just consult your vet. We are here to help. I want to start off with one that is not actually medication, but a drug that humans are not using in themselves for something much worse. So it's not really in here, but I thought it was way too important not to tell you about. So number 1, rat poison. And this can be red or orange depending on the kind of poison. Dogs eat this very easily because it has a sweet taste in it and it causes rats to bleed out from the inside, so it's a very terrible way to die. There are 2 kinds of rat poison, and the one that is labeled as red, very dangerous, is the one with alpha chloralose in it. Within 1 to 2 hours, they become hyperactive and wobbly at first. After that, they hypersalivate, get drowsy, weak, hypersensitivity to pain, hypothermia, shallow respiration, convulsions, and coma. They can also get respiratory failure and hyperthermia from repeated convulsions. When treated correctly and fast, they can recover from this. The orange poisons in the products are warfarin, brodifacoum, bromadiolone, chlorofasinon, cumatetrolil, difenacum, difacinon, and flucumafen, or any coumarin in it. The symptoms caused by these ones may not occur until 5 to 7 days later. So the symptoms are lethargy, exercise intolerance, problems breathing, pale gums, bleeding internally and externally, and hypovolemic shock, which means the shock that is caused because there's not enough blood volume. Also lameness, bruising, and anemia. Prognosis can be bad if the dog is bleeding a lot and a blood transfusion is not possible. Number 2, ACE inhibitors. This is a treatment used for humans but also for dogs when they have heart failure, high blood pressure, and so on. But if dogs get too much of this can cause serious problems, especially if they didn't have this medical condition in the first place. Symptoms are vomiting, diarrhea, low blood pressure, and a super fast heartbeat, otherwise known as tachycardia. And they might get renal failure. This all occurs within 6 hours after ingestion. Number 3, antihistamine. When ingested, signs within 4 to 7 hours are vomiting. Yes, I know. Again, hypersalivation, incoordination, lethargy, tremor, depression, hyperthermia, tachycardia or faster heartbeat, and weakness. In severe cases, also hypotension, so low blood pressure, respiratory depression, and coma can happen as well. Number 4, aspirin, or the active component called acetylsalicylic acid. When given too much, gastrointestinal signs will show within 2 hours, like vomiting, hyperthermia, rapid breathing, vomiting blood, ulceration, and bleeding in the stomach and intestines. In worst cases, pulmonary and cerebral edema, by which the lungs and brains will swell up with fluid. Also, renal damage, convulsions, and coma. Number 5, oral contraceptive pill. Now, this might surprise you, but dogs, and especially puppies, eat just about anything. So please also check out my quick start guide to dogs to get you started off in the best possible way so you can avoid medical problems and unexpected medical bills, and to get your dog the happiest and healthiest life possible. So with contraceptive pills, they won't exactly die from it, but nevertheless it's very unhealthy for them to eat it. Number 6, paracetamol. This is also known as acetaminophen, and in Belgium under the names of Dafalgan and Perdolan for the kids. Problems are caused by liver damage, dying off of liver tissue. Within 4 to 12 hours, there might be vomiting, fast heartbeat and breathing, difficulty breathing and hypothermia. The face and paws may swell up, and in more severe cases, renal failure also occurs. The prognosis is not so good because it has to happen fast and it has to be very closely monitored for it to be successful. Number 7, quinine. This medicine is used for night cramps and the treatment of malaria. Within 15 minutes to 2 hours, it causes vomiting, diarrhea, lethargy, incoordination of the limbs, fast heartbeat, low blood pressure, dilated pupils, yes, your dog will look high, off and on deafness, hypersensitivity to pain and tremors. In worst cases, blindness, collapse, convulsions, cyanosis, and arrhythmias. When this last symptom occurs, the prognosis is bad. Otherwise, it is favorable when treated correctly and fast. Number 8, Tramadol. This is used in humans to treat mild to severe pain. So don't be tempted to give this to your dog when you think he's in pain, because you will actually poison him. Within 2 hours, he will vomit, get drowsiness, lethargy, depression, incoordination of the limbs, hypersalivation, and constricted pupils, meaning they become smaller. In worst case, he'll get problems breathing, cyanosis or becoming blue, hyperthermia, convulsions, and coma. In rare cases, also agitation, fast heartbeat and fast breathing, and also hyperthermia. So never give your dog any human medications and put them safely out of reach so they don't gobble it up when you're not watching. Especially puppies, like I said, they're very curious and they will eat anything. So also, I'm not kidding, check out the quick start guide to dogs. It's totally free, guys. You can only win from it. Like I said, these are the most common ones. To list everything would make this video ridiculously long and very tedious. So it is a safe bet to say if you are taking a very special medication for a very specific affliction that you have, you can bet your ass it is very dangerous and very toxic for your dog. So don't ever give it and put it very, very safely away. Let's keep your pets happy and healthy together, and I will see you in the next video.